Hello, this is Dr. Kavian Melani for Virginia Medical Updates. In the treatment of type 2 diabetes, there are a number of new medicines and new protocols and methodologies that have emerged in the past few years, and I would like to share these with you today. First, as soon as prediabetes or an elevated hemoglobin A1C or elevated fasting sugar is diagnosed, a number of things must be set in motion. Baby aspirin needs to be initiated, metformin should be initiated, the goal of 7% body fat, 7% weight loss has to be initiated immediately to begin to reverse the prediabetes or type 2 diabetes. Essential at this point is the increasing of physical activity. The physical activity allows for increased oxygenation of the muscles, and also it does increase the glucose sensitivity of the muscles and the insulin sensitivity of the muscles. Therefore, it allows for more absorption and a better metabolism and a drop of glucose. So baby aspirin, metformin, exercise, and diet with the goal of reducing the body weight to 7%. In the next phase of the treatment of diabetes, it is essential to start a second medication if the first intervention is not effective. My personal choice is to avoid completely two categories: sulfonylureas and insulins. Insulins increase body weight, as do sulfonylureas. Neither one has mortality or morbidity data, and they basically have been replaced by better choices. So where do we go after the addition of metformin and exercise? Well, there are the class of drug that are SGLT2s, you have the DPP4s, and you have the GLP-1s. The GLP-1s at this point are all injections. They do cause weight loss. They do cause a reversal of diabetes, and they're great medications to add on board. The latest ones are available in daily injections or in a weekly injection, and they have shown to reduce the A1C to actually have outcomes that are really interesting. And at higher doses, they also can be used to achieve significant weight loss. The DPP4 class is basically weight neutral. It does work on the incretin system. It does help the achievement of a better A1C. And at this point, there are no data really to suggest that it can improve morbidity or mortality, but we do know that it does not contribute to increased mortality. So that's a positive thing. The other class are the SGLT2 class, which basically is a blockade of the reabsorption of sugar, so more sugar appears in the urine, and the body basically unloads sugar on a more continuous basis, and that causes a drop in blood sugar, obviously, weight loss that's mild, but also a slight drop in blood pressure. This class is also really interesting, and I think in the next few years it will have interesting data to suggest that it does help with decreasing morbidity and mortality. So in phase 2, definitely the GLP-1s are highly recommended. The drawback is that they're injections, but they're small needles and tolerable. But they do require some knowledge on behalf of the physician to navigate the terrain. The DPP4s are great medications. They're weight neutral, and the SGLT2s are fantastic medications with the caveat that they do sometimes increase risk of UTIs and urinary symptoms, but otherwise they're great medications. They unload sugar and have a lot of benefits. So baby aspirin, metformin, weight loss, and exercise in phase 1, and if that doesn't work, then the addition of the GLP-1, DPP4, and SGLT2 is amazing and is very beneficial, and I highly recommend these. And if there needs to be a third group added, I would recommend that of the GLPs or the DPP4, one be added to a SGLT2. And that usually is enough with weight loss and with a good program for diet to control diabetes and sugar and prevent any sequelae or bad outcomes. So in general, the baby aspirin also needs to be added and needs to be continued. The baby aspirin is very interesting. It used to be thought to be 50 years of age for men and 60 for women, but that data has now been revised. The latest studies do show that it's beneficial to start women also on a baby aspirin at the age of 50. And with this package, we can prevent a lot of morbidity and mortality in diabetes.